Mr. T is a 45-year-old man who presented to his primary care physician with progressive weakness, pain, and sensory changes in his arms. He was diagnosed with compression of the peripheral nerves from repetitive cumulative trauma. Mr. T is a single parent who enjoys spending time with his teenage son. He has a full-time job as a quality assurance inspector for a machine shop, which requires him to travel in order to inspect equipment and final products before distribution. He has leisure interest in fixing and maintaining cars with his son, working on the house, walking his dog daily, and caring for his dog and 2 cats. Mr. T's strengths are being hardworking, motivated, eager to regain function, cognitively intact, and willing to fully participate in therapy and complete his home program. His weaknesses are decreased sensation and grip strength, increased pain, and inability to open or manipulate small objects. Mr. T's prior medical history includes progressive upper extremity pain and sensation changes for the past year, including pain in the forearm when pronated, numbness and tingling in his hand, especially when sleeping or using his arms above his head, and trouble working with small objects. He takes Tylenol for pain and has allergies to pollen and penicillin. He is insured through his employer with BCBS. Prior to his injury, Mr. T was completely independent in all ADLs, IADLs, and occupations. These symptoms have progressively worsened over the course of the past year, impacting his ability to participate in his regular activities. Mr. T lives with his teenage son in a 1-story house on an acre of land in Magnolia, Texas. The house has 3 bedrooms, 2 full baths, standard tub showers, and hardwood floors. He has a 2-car garage. His injury has affected the following occupational performance areas: sleeping due to pain, IADLs such as meal prep, and participation in his usual home and car maintenance occupations due to numbness and decreased fine motor skills. OT will focus on sensory impairments impacting his functional performance. OT will need to assess light touch, localization, protective sensation including pain and temperature, fine motor skills, and nerve function. These will be assessed through touch threshold with Sims-Weinstein, static and moving 2-point discrimination, localization, the modified Moberg pickup test, pinprick, thermal threshold, vibrometer threshold, and quick dash. There are several environmental and contextual factors that will be important to consider as part of the evaluation. Because Mr. T's injury is likely a result of repetitive cumulative trauma from working at his job, a workplace assessment would be beneficial to determine modifications, compensatory strategies, and energy conservation techniques in order to prevent further nerve injury. A risk factor checklist or work experience survey can be used. OT will address the occupational area of IADLs, which includes driving, pet care, care of others, and home establishment and management through fixing cars and working around the house. The long-term goal is Mr. T will increase his right upper extremity grip strength by at least 30% in order to participate in IADLs of community mobility, pet care, and care of others within 12 treatment sessions. The short-term goals to support the long-term goal is as follows. Mr. T will increase right upper extremity grip strength by at least 15% to improve the ability to hold the leash while walking the dog within 4 treatment sessions. Mr. T will increase right upper extremity endurance from 5 minutes to 30 minutes in home establishment and management activities within 10 sessions. Mr. T will improve right upper extremity grip strength by 20% to increase community mobility through functional driving within 8 treatment sessions. Mr. T will use the motor skills of grips, aligns, stabilizes, manipulates, transports, and endures. He has the roles of father, worker, and pet owner. His routines include walking the dog, fixing things around the house, showering every morning before work, and making the same breakfast every morning. He values spending time with his son, commitment to his family, hard work, and pets. He holds strong beliefs in gun rights and freedom of speech. He is also Catholic. Mr. T needs the sensory functions of touch and pain, sensitivity to temperature and pressure, muscle functions of muscle endurance and power, and neuromuscular skeletal and movement-related functions of joint mobility. Mr. T's personal context is a 45-year-old employed man with a bachelor's degree. Mr. T's social environment has him spending time socializing with his coworkers during lunch and weekends, as well as spending time with his son every evening. OT will use the intervention approach of adapt, modify, and the biomechanical frame of reference. The intervention will focus on adapting the environment or adapting the activity. One activity will have the client holding objects that he can feel in his hands. From there, he will gradually work down to objects that are more difficult to detect. For example, Mr. T can start with a rock and be graded to a cotton ball. Another activity will involve Mr. T utilizing energy conservation techniques to increase his endurance, which will enable him to continue working. Service delivery is given by an OT in a gym and simulated kitchen in an outpatient clinic. Mr. T will attend 30-minute morning sessions 2 to 3 times per week.